Brain surgery has come a long way in the last 2 centuries. The collection of old photographs reveals the faces of earliest patients of modern brain surgery. A glimpse into a fascinating chapter of America's medical history, and now the images have been revealed by Yale University. The haunting images were discovered in a university basement alongside shelves of brains in formaldehyde, which have bewitched medical students visiting the campus Harkness dormitory. The images are of patients of Dr. Harvey Cushing, a pioneering neurosurgeon who left them to Yale upon his death in 1939, along with a collection of actual brains. While the collection provides a glimpse into a fascinating era of neurosurgery, it seems to create more questions than it answers. Of the thousands of images, only a quarter, around 2,500, have been catalogued completely. Dates and subjects for these images are unknown. The images showed shaved heads, scars, and oddly shaped skulls among the thousands of patients. The eerie feeling of the images is also due to their eyes staring into the camera. One of the most famous brains in the collection is of a well-known figure of the early 1900s, Major General Leonard Wood, a physician and a friend of Theodore Roosevelt. In 1904, in his 40s, Wood suffered seizures in his left leg, and a few years after the seizures, he found growing lump on his skull. In a groundbreaking 1910 operation at Johns Hopkins, Cushing removed a large benign growth proved to be a meningioma. Wood was cured of his seizures and resumed his active life, which included service as an Army Chief of Staff and a candidacy for the Republican presidential nomination in 1920. But the tumor later recurred. Wood died in Boston on August 7, 1927, during surgery on the brain tumor. Cushing's patients were among some of the first to undergo radical brain surgery. He documented their progress in detail as part of the Cushing tumor registry. Although some of the images are grotesque, they offer a fascinating view of surgery in Cushing's day. Patients staring into the camera lens with their right hand held against their chest. Patients were photographed in this way because doctors at the time believed hands could help determine health. They believed that many internal disorders and diseases would reveal themselves externally. Harvey William Cushing is well known as being the father of modern neurological surgery. He was the youngest of 10 children and from medical lineage, with his father, grandfather, and great-grandfather all being general medical practitioners. He undergraduated from Yale University in 1891, studied medicine at Harvard Medical School, and received his medical degree in 1895. In 1896, he moved to Johns Hopkins Hospital, where he trained to become a surgeon under famed surgeon William S. Halsted. By 1899, Cushing became interested in surgery of the nervous system and began his career in neurosurgery. During his tenure at Johns Hopkins, there were countless discoveries in the field of neuroscience. Cushing developed many of the operating procedures and techniques that are still basic to the surgery of the brain, and his work greatly reduced the high mortality rates that have formerly been associated with brain surgery. The All-Star Operation. Photograph of William Stewart Halstead operating with a mallet, Cushing across from him, participating in the first operation performed in the new operating room of Johns Hopkins Hospital. He became the leading expert in the diagnosis and treatment of intracranial tumors. His research on pituitary body in 1912 gained him an international reputation. And he was the first to ascribe to pituitary malfunction causes a type of swelling of the face and trunk. Now known as Cushing's disease or Cushing's syndrome. This stands a milestone in American medicine and more particularly in the history of endocrinology. That was in 1910 that Cushing had his first patient diagnosed with Cushing syndrome. The woman's name was Minnie J. In his landmark monograph titled The Pituitary Body and Its Disorders, Cushing described Minnie J's clinical situation as a syndrome of painful obesity, hypertrichosis, and amenorrhea, with overdevelopment of secondary sexual characteristics accompanying a low grade of hydrocephalus and increased cerebral tension. Cushing then performed a subtemporal decompression on Minnie J, aiding her headache, blood pressure, and weight gain. Minnie J went on live for decades longer until 1958, and her last known contact with Dr. Cushing was in 1932. Out of the 12 patients with CD reported in 1932, 8 died within a few years of their clinical presentation. This fact underscored the harsh reality associated with the natural history of this syndrome or disease. If left untreated, the disease can result in steady clinical decline and death. Cushing syndrome occurs when your body makes too much of the hormone cortisol. It can also be caused by a tumor or excess growth of the pituitary gland. This makes too much cortisol and causes Cushing syndrome. Cortisol affects blood pressure and blood sugar. It can cause inflammation. This inflammation means that people with this condition may have moon face and develop a hump in their upper back. In 1913, Cushing relocated to Harvard as a surgeon-in-chief at the new Peter Ben Brigham Hospital. Cushing continued to operate on countless patients a year with remarkable results, and in addition, he was relentless in his recording of patient histories. During the First World War, over a 3-month period in 1917, he and his team operated on 133 soldiers with a brain wound, reducing the mortality from head trauma dramatically. Lady Hostler, the wife of Cushing's mentor, asked him to write the official biography of her husband, William Hostler, who had died in 1910. Cushing put himself into this huge labor of love and wrote The Life of Sir William Hostler. The book won a Pulitzer Prize. In 1932, at age 63, Cushing retired at Johns Hopkins, though he spent almost his entire professional life at Harvard. His undergraduate years at Yale College were so formative and important to him that he returned to Yale at the end of his surgical career to be a starting professor of neurology and director of studies in the history of medicine. Cushing was given a large office in the New Haven Hospital, and he brought his extensive rare book collection with him. Cushing authored more than 300 articles and 13 books. These books always began with a discussion of anatomy, physiology, pathology, and chemistry. He had a huge collection of over 2,200 case studies of his patients, carefully documented by him. This encouraged him to make a library. He insisted that a separate building be constructed for use by faculty and students of the medical school and hospital. He used his rare book collection and encouraged his colleagues, John F. Fulton and Arnold C. Krebs, to join forces by donating the rare book collections to Yale to begin a rare book collection in the new library. But by 1938, it became clear that plans needed to be revised to add on a Y-shaped wing of the existing building instead to save on building costs. Harvey Cushing, suffering with his own health with vascular insufficiency of the lower legs, he declined the offer of amputation and instead found that cessation of tobacco usually improved his health within 3 weeks. On October 7, 1939, Dr. Cushing died from complications of myocardial infarction at age 70. Just days after he received the word that the funds had been allocated to build the medical library. Interestingly, as the pioneer of modern neurosurgical practice, his autopsy revealed a calloid cyst in the third ventricle. The rotunda of the Yale Medical is decorated in honor of Harvey Cushing and was the gift of Cushing's class of 1891. The words below the balcony read, "This rotunda is dedicated to Harvey Cushing, inspiring teacher, pathfinder in neurosurgery, master of the science and art of healing." This photograph from 1941 shows the historical library in use by students and researchers. The huge collection of Cushing, which includes human whole brain specimens, tumor specimens, microscopic slides, notes, journal excerpts, and over 15,000 photographs dating from the late 1800s to 1936. Dr. Louis Eichenhardt, who was working as editorial assistant of Cushing, curated the collection for the next 20 years, and the collection was housed in the Brady Museum sub-basement until the time of her death in 1967. When Dr. Elias Manueledes took over curation, space became an issue. It became necessary to find a new location. It wasn't until 1979 that a new space was found in the basement of the medical student dormitory. In the early 1990s, the collection was discovered by some adventurous medical students who had to sneak through dark crawl spaces to arrive at the brain room. After considering several new locations for the Cushing collection in the fall of 2008, the library directors agreed on the utilization of sub-basement space within the medical library previously used as an oversized stacks as museum for the brain tumor registry and the other Cushing memorabilia. In preparation for the move, each specimen was examined carefully and cleaned by forensic scientists. Dr. Cushing's extraordinary medical career, spanning over 40 years, including operating on over 2,000 brain tumors, and his discoveries and innovations have helped make neurology and neurosurgery the respected specialties they are now.